We don't really feel when the kidneys are not doing well until the kidneys are essentially not functioning at all. Many patients are unaware that they have chronic kidney disease. Up to 90% of individuals that have some variety of chronic kidney disease, either mild or severe, and are not even aware. Chronic kidney disease is a blanket term to describe when the kidneys are not functioning normally. It develops when the kidney is injured, and that injury then heals into a scar, and that part of the kidney is then no longer working. Chronic kidney disease and end-stage kidney disease or kidney failure are really on this spectrum. And so we start with stage 1 chronic kidney disease, where the kidney function is very much preserved. And as we progress to stage 5 chronic kidney disease, the kidney function then falls below 15. And that number is essentially what we use to quantify how much blood the kidney is filtering. So as we fall below 15, that would be the time that we would refer somebody to start dialysis. That is when we would kind of label it as end-stage kidney disease. Chronic kidney disease is an incredibly unique disease compared to other diseases of other organs because it is silent. And so we sometimes talk about high blood pressure as the silent killer. I think chronic kidney disease is really exactly the same. And so why is that? Our kidneys don't really feel pain unless there is a severe infection. I think as a nephrologist, what is most challenging is to communicate the gravity of chronic kidney disease and to really help patients understand how can this be so serious when they feel so well. And we wish that, the kidneys could tell us that there was some injury starting or that, we could hear them screaming, but we can't.
Chronic kidney disease is a major epidemic in our population. It still remains the 9th leading cause of mortality in our country.
As individuals age, the risk of chronic kidney disease increases. Our kidneys, we know evolutionarily, are not built to last forever.
Chronic kidney disease, unfortunately, does affect individuals who have diabetes and hypertension where they've struggled to take care of themselves. And it may be a lack of medical attention or a lack of education in that process. Individuals often come from lower socioeconomic conditions with chronic kidney disease because of that inability to manage those chronic disease processes effectively.
Unfortunately, we know that Black individuals are 4 times more likely to be affected by chronic kidney disease and end-stage kidney disease, and why that is the case is complicated and not related to their race alone, but rather social determinants of health. So for example, what is their access to health care? What is their access to preventative and primary care? Their access to healthy foods, their environmental exposures that they may or may not have. So I think there's a lot of factors there that are contributing to this disparity in who is impacted by chronic kidney disease.
And our system, unfortunately, has been built on waiting till the last minute. So many patients will go into dialysis emergently and with very little education or very little understanding of chronic kidney disease, or without even referrals to nephrology.
I think it is our job as members of the nephrology community to be really intentional about how we communicate this, to raise public awareness, to empower patients to ask their providers and their physicians, what is my kidney function, particularly if they have these known risk factors.
So it really takes someone astute to see the patient and think that they're at risk for kidney disease, to say, let's look at your kidney health. Let's check these labs, a really simple blood test, a really simple urine test, and see how your kidneys are doing. But unfortunately, that's not being done. So even among high-risk patients, like people who have diabetes and hypertension, only about 30% are actually getting completely screened. And this is happening when we know that kidney disease is increasing as a cause of mortality in the United States.
Unfortunately, our healthcare system for chronic kidney disease exists in silos. And so if we have a system by which we can truly rely upon the back and forth communication, by creating this network, you basically are able to create an efficiency and not have people crashing into dialysis or having critical emergent care provided for months and months before they are able to be considered again for a transplant.
What I wish I could change is the public awareness of kidney disease and to try to really highlight the importance of the kidneys. And when you're going to see a doctor, being empowered to ask your provider, what is my kidney function? And what can you do if you have kidney disease to try to slow the progression, to try to avoid ever seeing dialysis or ever seeing a transplant? And I think that really starts with being clear that chronic kidney disease is silent. It is out there. There are so many people that have it and that don't know. And if many of those people knew, we could potentially prevent them given the tools that we have to ever getting to end-stage kidney disease. My overall hopes for the kidney care industry are that we have a cure for kidney disease, that we can diagnose kidney disease better, that we can screen for patients and identify really, really early chronic kidney disease and intervene if we can to try to prevent this progression.